Hello, everyone. I'm Dr. Maria Paul. I'm a rehabilitation physician, and I am the secretary for the Emergency Rehab Committee of ISPRM. And today with me, I have Pete Skelton, who is the WHO lead for rehabilitation and emergencies. He's going to be one of the keynote speakers for our conference in Vancouver in less than 3 weeks. Hello, Pete.
Hi, Maria, and thanks for the invitation.
You're welcome. Could you tell us a little bit about what you're going to talk to us in Vancouver on?
Thank you. Yeah, my session is going to be on integrating rehabilitation into disaster preparedness. And it's a really important topic at the moment. So globally, we face growing challenges with disasters, but also conflicts, outbreaks. And we increasingly have really strong recognition that rehabilitation is a key component of response when we have these type of emergencies. So we know that rehabilitation is key for better patient outcomes. We also know and have solid evidence that it makes the health response much more efficient. But unfortunately, we have a problem at the moment, which is that although we're recognized as being part of response, we're not yet really an integral part of emergency preparedness. So the focus of my topic is going to be how we as rehabilitation professionals can take steps to better integrate ourselves into emergency preparedness. And that will go really from the level of personal preparedness. So what can we do as individuals, to how we can better prepare our patients, because we work with some of the most vulnerable people in our communities. So whether patients with spinal cord injury or brain injury and things like that. So how we can ensure that they're personally prepared if there are emergencies in their local area as well. But then to our facilities. So how can we be sure that our facilities are safe, that they can withstand emergencies, and that we can safely evacuate, for example, patients and staff when a disaster hits. And then lastly, what can we do to better integrate ourselves into the overall health system approach to preparedness? And this is really, really fundamental, that we won't see effective response unless we're an integral part of emergency preparedness. And the presentation that I'll give, and also the toolkit that we've developed and that we'll be launching as WHO, really walks through rehabilitation professionals and rehabilitation leadership step by step about how they can better integrate themselves into that level of preparedness so that we get better responses. And that means we can take better care of our patients and we can get better outcomes for our patients, which is the most important thing.
That's fantastic. Now, so far in your work in this area, have you encountered any major challenges?
So a number of different challenges. I think, the big one is that we aren't prepared simply. So when an emergency hits, what we often have is then a lag in the first few days where people recognize that rehabilitation is important, but we don't necessarily know how to respond ourselves. So what we do in the toolkit is we set up the steps that we can make so that we've got the correct leadership in place when an emergency happens in a country, and that's national leadership, so that the country themselves can respond, that the response is well coordinated, that all the rehabilitation actors know each other, and that we're part of the care pathway. And that really would make a fundamental difference, because if we don't respond immediately, we get a lag and we lose patients to follow up. And again, then patient outcomes are compromised. So this is really the big problem.
Really looking forward to learning more about this and understanding the toolkit. So thank you very much for your time
Thank you, Dr. Paul. Thank you.
in Vancouver.